Hello, if you are watching this video, you've just received your prosthesis, and we want to thank you for choosing Prevail for your care. And if you ever have any problems or questions, always feel free to reach out to your practitioner and we can address that because we want to see you prevail to the best of your ability. Our phone number is 1-800-745-3295, and then just ask for your practitioner and we should be able to get them for you so you can have your questions answered. Today what we're going to do is talk about shrinkers, liners, and sock fit. We want to make sure that your limb is in good health for the prosthesis, and we also want to make sure that you are properly fit inside your prosthesis. Our bodies fluctuate day to day, and we've got to be able to make sure that we have a good snug fit inside the prosthesis. So we are going to go over this model here. And we're going to put on a shrinker properly. This is a below knee prosthetic shrinker. There's above knee as well, and the same donning procedure is the same. You'll see that there is a beaded top, and that is to help suspension of the thigh so that the shrinker does not fall off when you're sleeping or in a bed. The first thing that you'll do when you don a shrinker is you're going to find the seam, and the seam needs to go the side to side of the limb, not front to back. You're going to open up the shrinker and then just put it on the limb just like a sock. You want to make sure that all the wrinkles are out of it and that it is above the knee, and you usually wear your liner 23 or 24 hours a day. You can throw this into a sink, wash it with soap and water, and let it air dry. Normally you're given 2 shrinkers, and that way while the other one's drying, you can wear the other one. It is very important that these stay clean. Once you're ready to be fitted for your prosthesis, you will be measured by your prosthetist a liner. There's several different liners on the market. These are 2 examples. We've got a pen system and we've got a cushion liner, and that is based off your conversation with your prosthetist to decide what type of suspension that you will need. What we're going to do is talk about donning a pen system, and it's very important that this pen comes straight off the limb. It can't be pointed sideways, up and down, because that pen is going down into your prosthesis into a lock to lock on. And if it's canted one side or the other, it's not going to be able to get into that hole, and it will have a difficult time trying to fit you with your prosthesis. So to put this on, you're going to take the liner, turn it inside out, put your hand inside to kind of push it up, and it is very important that you squeeze out as much as you can to get it as flat as you can, because we don't want any air trapped between the liner and the limb, because that can cause other issues. So you want to get it as flat as you can, and normally with a pen system you can see the center of the hole, so you can kind of help line the pen up with your limb. So you're going to put it up against your limb, and then you're going to roll the liner up. And if you need to adjust the pen, you'll have to roll it back down, move it up, and put it back on. But it's very important that you always roll up your liner, never pull it up. And then to take it off, you're just going to do the reverse. You're going to roll it off, and you're out of it. The same thing applies with the cushion liners, but the only thing with the cushion liners is you don't have to deal with a pen, so they're a little bit easier to turn inside out and get it as flat as you can on the bottom. To wash the liners, we recommend that you put it in a sink and you get a mild soap, like a plain old ivory soap, and wash it inside and outside. Always let it dry with the fabric on the outside. Just put it on a towel and let it dry. Never let it dry with it inside out, letting the gel be exposed to the environment. Once a week, we recommend that you get a spray bottle of 50-50 water and alcohol mixture and spray the inside to kill any bacteria that might be in there. You always get 2 liners as well. And the reason for that is it's very important that skin hygiene be good inside the liners. So when you're washing one, you can have the other one for backup the next day. So wear one day, wash it, wear the other day, and rotate them every day. You get 6 months for the liners. Once you hit your 6 months, insurance is typically going to pay for a new set of liners, and your practitioner will discuss that with you as well. It is very important that we maintain comfort inside your socket. And as I discussed earlier, that you are going to fluctuate in your volume, and it's very important that you be aware of that. And this is the problem that we have with many APTs at the beginning, is understanding the fit and how to use socks to accommodate volume fluctuations. So typically you have 3 socks. You have a 1-ply, which is denoted by a black ring universally, and usually sometimes it'll have a 1 on there as well. Ours do not. Next is a 3-ply. This has a 3 and is denoted universally with a yellow. And then you'll have a 5-ply, which has a 5 here and is universally denoted with a green top. Your 1-ply is your thinnest sock. 3-ply is middle thickness, and 5-ply is the thickest that you can have. So how do you know if your socket is too loose or you're having issues inside your socket? You want to go down into your prosthesis with a little resistance. If it goes right into the lock or right into the prosthesis and you're starting to feel pressure on the bottom of your leg or your shin bone or your kneecap, that is usually a good indicator that you're going too far down into the socket, and we want to take weight off the bottom of the prosthesis. Many people think that we're bearing weight on the end of the limb, but we're not. We're bearing weight through this whole section here and actually taking the weight off here. So if you're going in too easy, you're going to hit the bottom really hard. So that is your indicator that you will need a sock. Usually we tell you to start out with a 1-ply, and I'm going to put on the Penn System liner. Show you how to go. It is very important that the liner is the only thing that goes against the skin, and then the socks go on the outside of the liner. The reason I'm doing a Penn System is because most of the Penn System socks have a hole in the bottom. And what you'll do is put your 1-ply in first, open it up, put the pen through the hole, and pull it up and make sure there's no wrinkles. One common thing that we do see is when somebody is getting in a hurry, they'll put their liner on like this, and the sock is over the pen, and it can go down into the lock and get stuck, and they get stuck into the prosthesis. So make sure that you pay attention to make sure that the sock is all the way on the bottom of the liner. So then you'll put your limb down into your prosthesis, see if that alleviated the problem that you were having. If it did not, then you'll go to your 3-ply, and if that doesn't work, you will go to your 5-ply. Now, you'll get to the point where maybe the 5-ply is not enough, but you can add socks. So you'll put the 1 on first, I'm gonna put the 5 on here.
Make sure you pull it up.
Up, it's not on the pen, and now you have a 6-ply fit. Typically, when a prosthesis is fitting consistently at a 10-ply, which is 2 5-ply socks, that is a good indicator that we need to change the socket and do the process over of making a new socket, because that becomes a little loose inside and you don't have as very good total contact. So I hope this gives you some information about how to properly don liners, shrinkers, and socks. Again, if you have any questions, always feel free to reach out to your practitioner. We're here to help you, and we want to make sure you prevail.